My name is Larissa Borowiec. I'm a second year athletic therapy student, and your name is? Christina. Okay, so do I have permission to help you with your ankle today?
Yep.
Excellent. So first I want to know, have you been taped on the ankle before with the spray?
Yes.
Yes, so you're not allergic to the adherence spray?
Correct.
Correct. Okay, so if we didn't know if they were allergic or not, we would do a test patch on their wrist. If we saw that they were allergic, we'd use skin prep first, but since Christina is not allergic, we can continue with our process. So first thing I want to do is clean my hands. And then I'm going to observe the ankle, looking for any decap ETLS, so any deformities, contusions, abrasions, penetrations, any burns, lacerations, tenderness, and swelling. I don't see any of that, so I can also check sharp. So our swelling again, we can check for heat, any altered function, any redness, and any pain. Everything seems okay, so we can continue. We're going to want to check our PMS before we start our tape job, so I'm going to check our circulation on the toe. About a 2-second cat refill. Can you wiggle your toes for me? Perfect. And can you feel that?
Yes.
Excellent. The first thing we want to do is clean the area, so we'll use an alcohol prep pad and clean the area of any oils and residue. Now, Christina, when I'm doing this tape job, I want you to try to get as close as you can to that neutral foot position, so bring those toes to your nose, but to where it's comfortable for you. So is that comfortable for you there?
Yep.
Perfect. So we know you're not allergic to the spray, so we can go ahead and spray it. And we can apply our heel and lace pads and our horseshoe. The horseshoe, I want to make sure that it is covering that soft tissue under the point of the malleolus. And just to make it a bit easier, before we do that, we can put in our pre-wrap in between the toes. So now our pre-wrap is ready there. I'm going to have my horseshoe, as I said, just below the tip of that malleolus. And Christina, if I could get you just to hold that for me. Perfect. And keeping that foot in that comfortable position, we're going to start our pre-wrap from the distal end of the foot. And moving upwards. We want to try and ensure that our pre-wrap is not getting any folds or wrinkles as we go. Okay, you can move your hand and sit back. Thank you. Okay. So now that we have our pre-wrap on, we can now begin the taping process. So we're going to start, all our tape is going to have a channel down the middle, so we'll start with our 3 anchor strips. Just to give you a better angle. So starting our second anchor strip, overlapping halfway. Keeping that channel. Our third. We're now going to put one on the distal end of the foot as close to the toes as we can. Again, maintaining our channel. We're then going to do our 3 stirrups. So this was inversion, so we want to make sure we're taping in the correct direction. Starting on the medial malleoli and coming over the lateral. Applying our strips to help close and hold that. Each time, this adds compression as well. second anchor, we'll be fanning them. So this one's starting anterior, ending posterior. Locking that in again. And our third anchor, starting posterior, ending anterior. And now we're going to continue our horizontal strips all the way down, keeping our channel open. Really trying to compress over here on the lateral aspect of the foot where we want that compression. So now that we have that, we can start with our broken figure eights. So as if we were going to start from the lateral malleolus, we will start on the other side of the channel, going down and around as if we were doing a figure eight, cutting it for our channel, and around the back. We're then going to do our broken heel locks, or unbroken heel locks, and around the back, back to the front. Our heel lock the other way. And we're going to do it again. So once again, our figure eight to start. Compressing over that lateral side. Our heel locks. Our heel lock on the other side. So now that we have that, we want to close any open windows we have. I notice I do have one around the bottom of the foot and around the bottom of the calcaneus. So we're going to close those with tape as well. Maintaining our channel. Okay, now that all our windows are closed, we can now start to finish off the tape job by applying this tape over top to prevent it from coming off when the athlete puts their socks on. So we can do this in two segments. There's our first segment and our second segment. We can do the other side. Really molding this down so that it's not coming up on the athlete. So that's the tape job. So first thing we want to make sure is recheck our PMS. So we want to check our pulse. 2-second cap refill the same. Can you wiggle your toe still? And can you feel that?
Yep.
Perfect. So what I want to make sure you know is that when you go home, your compression, elevation, and ice is going to be very important. Elevation probably the most important. So while you're sleeping, get your foot under some pillows or even raise your mattress with textbooks. Get your foot about 6 inches above your heart. And is the tape comfortable for you?
Yep.
The tape is comfortable? Okay, perfect. So when you want to take it off, or let's say the pressure starts to get a little bit too much, you can loosen it. All you do is take some scissors, or a shark if you have one, but most likely scissors. Cut right down the middle in this pre-wrap, and it'll loosen some of that pressure. And if you do want to take it off, the same thing. Cut right down the middle, and then you should be able to peel it apart. Like I said, though, your compression, elevation, and ice is going to be the most important. This is providing your compression. You really need to focus on your elevation for tonight. Sounds good?
Yep.
Perfect.